The most important need for myeloma patients is that we need to find a cure for patients. So that means that the cure is probably going to be effective when it's applied early on in the disease. So if we get a therapy that is a 100% effective, or a combination of therapies which turns out to be 100% effective and gives the patient a repression of their myeloma for the rest of their lives, obviously that is a cure. And we may not be able to achieve it in more than maybe 5 to 10% of patients at this point. But some people at this point are being cured. I know that for sure, because we have patients who are 20 years out, still in remission, and never moved there from day one. So that number is going up step by step. Now, for a transformative cure to happen, we need to have a transformative therapy to happen. And that, I don't think we have got there yet, but we may be getting there with some of these immune approaches that we just talked about. And those approaches, to be curative, will have to be integrated earlier into the disease, because later in the disease it becomes more refractory and it becomes multiclonal with more clonal heterogeneity, meaning that there are many different kinds of myeloma living in the same person, and some of them may be sensitive to your treatment, some of them may be less sensitive. So that's, I think, the biggest medical need. Now, beyond that, there are actually a lot more other things. We forget about supportive care. So patients with myeloma being an immune disease, are at risk for infections, and we lose patients to infections. Actually, the first few months of myeloma treatment, the biggest loss is from patients who succumb to their infections. The second issue is bone health. Myeloma is a disease of the bones, and most people with myeloma have weak bones, and some people have suffered extensive bone damage even before they begin treatment, and they are in constant pain for the rest of their lives. So better pain control, better bone healing, restoring strength to the bones, avoiding future bone problems, that's another big unmet need. Finally, some patients with myeloma have kidney failure at the presentation. And many of them now, we are able to save more and more people from sustained kidney failure or need for dialysis, etc. But still, we have patients who never regain their kidney function back, and that kind of puts a dampener on their life for the rest of their lives. So if we can cure myeloma, more and more people will go forward and get kidney transplants or other mechanisms to fix that. And we need to save kidneys whenever the patient presents. So there are all sorts of supportive care needs that are not being addressed. But I would say the major scientific need is to find a cure which is sustained. And I think my personal feeling that might come from immune approaches integrated into a drug approach.